1934.
Yeah, well, that's really terrific and all that, but they don't have to mention that it isn't listed in the Pharmacopoeia. That's a little misleading in that it was listed in most pharmacopoeias up until now, and the only reason it was taken out was so that the pill pushers would have a monopoly. It also, if you just make light of it as an appetite stimulant rather than pointing out, taking the time to point out it's the only real appetite stimulant out there, pill, herb, or otherwise, I just think that, you know, they could distance themselves from it without kicking it and dissing it, and like avoid being the dispensers without being the critic of cannabis.
Yeah, there's two things. I mean, one, I also heard them say that the first time when they said it, I heard them say, you know, we have certain drugs in society that we condone. And the first time I heard it, them saying, why add another one to it? But actually the second time they were saying, let's just add cannabis to it. So they sounded, the one person sounded like he was for legalization but still didn't want to have anything to do with his medicine. What I'd like to see them do is to say, we don't believe in Health Canada's program, we don't think we're the right people to be dispensing herbs, but we do recognize it as a medicine that significantly helps people with things like appetite stimulation, wasting, and pain, but we're not the right people. I would like them to acknowledge that as well.
Do you think doctors have helped or hindered your patients at the Compassion Club?
Well, all of our patients require a doctor to sign a form that confirms their diagnosis and in most cases recommends the use. So in terms of our members, they have had the assistance of doctors, which is another thing that's interesting because the Canadian Medical Association, if they speak badly of cannabis, definitely does not represent what we've seen. You know, there's 5,000 members across Canada of different Compassion Clubs, so they're not representing the way a lot of doctors feel. But then again, there are a lot of people who can't become members of our club because they're having a really hard time finding doctors because they're afraid of their National Health Protective Association taking away their insurance, and they've been told by the College of Physicians and Surgeons not to.
So are more and more doctors taking part in Compassion Club activism and acting as buffers for police raids, or are less and less doctors getting involved in it?
That's hard to say because what the Compassion Clubs have also done is we've been moving with the times. As soon as we hear that Health Canada is telling their doctors, or not Health Canada, the Canadian Medical Association and the National Health Protective Association are telling doctors not to fill out Health Canada's forms, that had an effect on them even filling out Compassion Club forms. So we started changing the way we had forms to be filled out. Before they had to recommend it. Now they don't. Now we're saying that for certain conditions, and a lot of them, they don't even need to have anything about cannabis. They can just confirm their diagnosis. And then there's the club in Montreal, which went even further, which was to say that people don't even need doctors. They can just go and swear, take an affidavit and swear that they have a certain condition, and that's fine. I think that's great.
So do you think that the Vancouver Compassion Club, the British Columbia Compassion Club Society, would look at the affidavit system sometime in the future if the doctors continued not to cooperate?
We do what we have to do. You know, we have to balance our members who are significant in number having access to their medicine, but we also keep pushing the boundaries, and that does have to be done, so it's not out of the question.
Right.
Cannabis, hypnotic, analgesic, sedative. Merck Manual, 7th edition, 1940. A particulate delirium which is accompanied with exaltation of the imaginative functions, not infrequently with hallucination, and later by a remarkable loss of the sense of time. Cannabis has been used in medicine to relieve pain, to encourage sleep, and to soothe restlessness. In some persons it appears to produce a euphoria, and will often relieve migranic headaches. The United States Dispensary, Osel Farrar, 24th edition, 1947. Smoking marijuana produces a mild state of intoxication which is popular among maladjusted adolescents. No tolerance is developed, and there is no abstinence syndrome in the case of marijuana. Merck Manual, 8th edition, 1950.
And what's this group, Canadians for Safe Access? What are they involved in?
Canadians for Safe Access is a relatively new organization that is, it's been formed, so it's a grassroots, action-oriented organization. It's basically to do all of the activism and advocacy work so that Canadians can have access to safe medicine.
And what's the latest project? Is there a website or something?
There is.
Okay, what is that?
Well, it's probably CanadiansForSafeAccess.ca. Actually, maybe I have it here. Let's see. www.safeaccess.ca.
Oh, great.
Yeah.
Excellent. And is there anything else, press release? Is there anything coming up that we should know about?
Canadians for Safe Access, we've been putting out a lot of press releases. And the latest one that's going to be coming out any day now is about the Health Canada's product, which the doctors had even pointed out in their well, actually it was a National Health Protective Association president said that, isn't it interesting how Health Canada has made sure that they are safe or indemnified for putting out bad product, but yet they're not taking into consideration doctors' liability issues. So I think they were they were foreseeing how bad the Health Canada product was going to be. So we have got access to Health Canada's pot that they've been calling medicine that they've sent out, and we're going to be sending out a press release about its quality.
Right. What is the difference between the pot that you get at the Compassion Club and the variety and the services you get at the Compassion Club and what Health Canada is offering for cannabis medicine?
Well, where should we start? So Health Canada, if you just talk in terms of the quality of the product, is sending out non-organic, very low potency, about 3% THC, a mix of bud, stems, and leaves, all mixed up and blended together. So that's their product. There's only one strain, and people still have to pay for it.
And as much or more than they have to pay at the Compassion Club?
They have to pay, they're paying the low end of what the Compassion Club pot would be. I think they have to pay $5 a gram, but they're going to have to consume a lot of that 3% swag to get any effect. So the Compassion Club has, usually 8 to 10 varieties of strains available, including hash and different resins and cookies and tinctures, and our prices definitely could come down, but we're working on that.
And for that price, you also get access to the other herbs and other forms of alternative medicine.
Yeah, at the BC Compassion Club Society, our members have access to other natural health care practitioners and modalities. They can see herbalists, nutritionists, counselors, doctors of traditional Chinese medicine, acupressurists, Reiki practitioners. So they're getting holistic healing. They're not just getting the symptom relief, they're getting the full-on natural cure.
Right on. And what is the Compassion Club's website? Website for the Compassion Club?
www.thecompassionclub.org.
Awesome. Well, thank you, Rielle Capler. Thank you and all the staff at the Compassion Club for doing such a good job looking after how many members?
2,500.
2,500 members. Awesome.